Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
reversal of the block of muscle relaxants. All non-depolarizing muscle relaxants should be reversed. Most of them have signs of spontaneous activity, so they should be reversed. So the agents which are used for reversal of block of neuromuscular agents include cholinesterase inhibitors, gamma cyclodextrins or sugamadex, L-cysteine. So first, cholinesterase inhibitors. Cholinesterase inhibitors like neostigmine, pyridostigmine, edrophonium are can be used, and they are the reversal of choice for uh, non-depolarizing muscle relaxants, mostly mivacurium. These cholinesterase inhibitors does not inhibit pseudocholinesterase. So neostigmine can be combined with glycopyrrolate and it can be used. Pyridostigmine is long acting, whereas edrophonium is short acting. Edrophonium is the reversal agent of choice for mivacurium. There is increased, so because of these cholinesterase inhibitors, they will inhibit the metabolism of acetylcholine to acetate and choline. That is, breakdown of acetylcholine is inhibited by cholinesterase inhibitors. So as a result, there is increased acetylcholine is seen, and thus this will result in competitive antagonism. Then there is also um, increased acetylcholine, and as a result, because of this increased acetylcholine, there can be uh, muscarinic side effects may be seen. So in order to counteract the muscarinic side effects, we should give an anti-muscarinic drug like glycopyrrolate is more preferred than aspirin. Gamma cyclodextrins or sugamadex. Gamma cyclodextrins or sugamadex can be used for reversal of the block. Advantages of sugamadex. There is no need for muscarinic agent, anti-muscarinic agent. There is no need for anti-muscarinic agents while using sugamadex, and it is faster onset of action. That is, it action starts within 2 minutes and it produces deeper block. Disadvantages of sugamadex or gamma cyclodextrins are these cannot reverse the benzoquinones, and these are costly, and sometimes minimal anaphylaxis is seen with sugamadex. Then other reversal agent which blocks the reversal is L-cysteine. L-cysteine will reverse the gantacurium, and this L-cysteine reversing the gantacurium, and it is metabolized by cysteine reduction. Signs of adequate reversal. The signs of adequate reversal include there are clinical signs like adequate ventilation, able to if the patient is able to protrude the tongue, or if the patient is able to lift the leg and hand, if the patient is able to open his eyes or lift his head for more than 5 seconds, if he is able to clench the tongue depressor between the incisors, this is better than head lift. So in all these conditions, will all these if all these are present, then we can say that there is adequate reversal of the agent. Guaranteed recovery is also seen in this thing. Okay, in guaranteed recovery is seen if train of 4 ratio is more than 0.9.
summary about the reversal agents. Reversal of block is done by uh, cholinesterase inhibitors like neostigmine, pyridostigmine, edrophonium will are the reversal of choice for the non-depolarizing muscle relaxants. Especially edrophonium can be used for mivacurium. Neostigmine is for neostigmine glycopyrrolate is added, and pyridostigmine is long acting and edrophonium is short acting. But these does not inhibit pseudocholinesterase. Because these cholinesterase inhibitors will increase the acetylcholine, there are muscarinic symptoms, to counteract the muscarinic symptoms, we should give anti-muscarinic agent like glycopyrrolate or atropine is administered to the patient along with these agents. Gamma sugammadex or gamma cyclodextrins or sugammadex, these do not need any muscarinic anti-muscarinic agents. These are faster onset within 2 minutes, and they have deeper blockade. So the disadvantage is they cannot reverse the benzocurium, and they are costly, and they have minimum anaphylactic reactions. L-cysteine is also a reversal agent. L-cysteine reverses the gantacurium, and it is metabolized by cysteine reduction. Signs of adequate reversal is if there is adequate ventilation, if the patient is able to protrude the tongue, or if the patient is able to lift his leg or hand, if able to open the eyes, or if he is able to lift his head for more than 5 seconds, or able to clench the tongue depressor between the incisors, then this states that there are adequate signs. These are the signs of adequate reversal.
Thank you, and thank you for watching.